There is a lot of information out there about the causes of thyroid conditions, things like Epstein-Barr Virus, Lyme Disease, small intestinal bacterial overgrowth, gluten intolerance, cellular inflammation, and much, much more. Any combination of these underlying issues could be the cause of Hashimoto's and Graves'. There is no shortage of articles recommending different programs, eating plans, exercise strategies, medications, bioidentical hormone therapy, and it can be very frustrating. Now, some women have poured tons of money into supplements and labs with little to no results, and they just want to feel better. They just want to know what to do and who to believe. It can be very confusing, especially when you start doing research and then start asking your doctor questions, and he or she tells you something that conflicts with all of your research. One woman posted in our group that she had been researching and asked her doctor to run a bunch of tests and wanted to know all about supplements. And the doctor's response was this: "Why do you need to know all of that? I'll treat you the same way. You don't need to take supplements. They'll just inflame your liver, and the internet and all the reading that you've been doing is just going to drive you crazy. So just take your medicine and leave it alone." Man, sound familiar? It's really sad. We often read comments on other blogs as well about people that just love to give advice. Even advice like, just juice celery that will solve all of your problems. Really? I mean, some people have reported that the doctor says all of their labs are fine, and they've already cut out gluten, dairy, and nuts, but they still feel miserable. So it can't be their diet, right? No wonder they're frustrated. If medications are not helping, cutting out certain foods aren't helping, and if the doctor is not helping, then what is a person supposed to do? If that sounds familiar, my wife Joan and I completely understand. We've been there. My name is Dr. Brian Coker, and my wife Joan is a registered nurse. We've written books, created programs, and personally worked with over 1,000 women with thyroid conditions. But our passion was ignited when Joan was pregnant with our son Elliot. A pregnancy, although a blessing, is always stressful on the body. That, combined with the stress of life, created the perfect storm and overwhelmed her immune system, which led to Hashimoto's disease. And as you know, that's an autoimmune disease that affects the thyroid. That was a tough diagnosis to deliver. We'd already been helping women with autoimmune conditions for years, but when it literally hit home for us, it was pretty devastating at first. But then it just took our passion to a whole new level. We understand how overwhelming all of this can be, and the challenges for people with busy lifestyles to weed through all of the information on the internet, pull out relevant material, compare and contrast to current findings, learn what's working, avoid what's not working, figure out what to do first, and then systematically implement all of that into the hustle and bustle of daily life, all while feeling sick and miserable. It's hard to do, so we did it for you. Here's what we found. There are a lot of underlying causes that are being overlooked, and people are being led to believe that there are 3 easy steps or one magic herb or a medication to solve the problems. But there is way more to the story than that.